When I meet with a patient, patients are asking, what am I looking at? So my first determination is, what is their existing state of hair? That's super important to find out where this patient's at in their hair loss progression. The second thing I'm going to look at is, what are they doing to preserve their existing hair, and how motivated are they going to be to kind of preserve the rest of their hair? And based on that, and based on other factors, such as their existing hair density, the type of hair, the waviness in their hairstyle, and a multitude of other factors, can determine what is the best process for them. And for most patients, it involves two different things. One is hair preservation, and the second thing is hair restoration. Hair preservation involves techniques such as medications, nutraceuticals, hair topicals, light therapy, injectables such as PRP and exosomes, all of these types of things to preserve the patient's existing hair and to prevent the miniaturized hairs from turning into hair loss. Restoration is really where the patients have already experienced hair loss and now want to restore those areas. And restoration is going to involve taking hair from a different area of the back, usually the back of the head, and moving that hair to the area that is missing hair. So restoration is typically a procedure, and preservation is typically a multitude of things that work together. I think both are important because we want to preserve as many hairs as we can and avoid hair restoration, but we have to know at some point there's a limit of what we can preserve, and hair restoration is going to be super important for our men to feel confident and establish their hairlines and hair crowns and other aspects of their hair that gives them insecurity, to give them the fullest potential head of hairs possible.